another Top Doctors online interview with one of our leading consultants. Today, we are so pleased to be joined by Dr. Emilia Duarte Williamson, consultant dermatologist based in London. Dr. Emilia, thank you so much for being here with us today. We really appreciate you taking the time. Would you like to introduce yourself?
Yes, thank you. Thank you for inviting me. I am Dr. Emilia Williamson. I am a consultant dermatologist, and I'm working in King's College Hospital, London at present. I do general dermatology, eczema, psoriasis, and I do pediatric dermatology too, and some skin cancer and surgery.
Perfect. Thank you so much. So today we're going to be speaking about monkeypox, which is something that I think we've all heard of. It's made many headlines this year. So let's find out what it is. So what exactly is monkeypox?
Monkeypox is a rare disease. It's a disease caused by the monkeypox virus, which is a kind of virus called the orthopox virus. It's very similar to the virus that caused smallpox in the past, which was very severe and caused lots of deaths. But that virus was eradicated through a widespread worldwide vaccination. However, this virus tends to give a more milder disease. So the disease is not as severe as the smallpox virus, and it just have some similarities.
Okay, perfect. Thank you. I didn't realize they were related. Interesting. How does one get monkeypox? Is it contagious?
Yes, it's contagious. So the virus initially, the first cases were reported in humans in the 1970s in Africa. So there have been a few cases reported from Central and West Africa. For probably traveling situations, the virus was exported to many countries in the world. Recently, there have been reports in many countries. In the UK, there have been many cases reported. Yeah, and you get it when you get in contact with the patient that is infected. So the patients have a skin rash. If you come in contact with the rash, you may get the infection. If you touch the clothes and the linen and the sheets of these patients, you can get it too. If you have a conversation, a prolonged face-to-face conversation with a patient, you can get it through respiratory droplets. And also, if you have intimate contact with a patient with monkeypox, you will get monkeypox.
Perfect. Very interesting. And what are the symptoms of monkeypox?
So after a few days after you come in contact with someone with monkeypox, you may get very non-specific symptoms like a cold, fever, malaise, chills, and then you can get headaches, muscle ache. So all very non-specific. The inflamed lymph nodes tend to be very characteristic of monkeypox. And like 1 to 4 days later, you will get initially like flat spots on your body, and then they will turn into vesicles, little fluid blisters on small on the mostly on the face, the mouth, around the eyes, on the limbs. You can get these lesions on the genital area, and then it can spread or can be very localized. It varies. You can have a few lesions, or you can have multiple lesions everywhere, and that's when the patient is very contagious.
Okay, perfect.
And
Thank
then
you.
the patients feel like in 2 or 3 weeks they get better, and that's it. When the crust fall off, that's when the patient is not contagious anymore.
Okay, super. And I was just going to ask, what does it look like on the skin? Is it similar to, for example, chickenpox, or is it completely different?
Well, it can look slightly similar, although these lesions sometimes coalesce and give you large patches with crust, and they're very dramatic, and sometimes they are very spaced out lesions. It varies in the form of presentation. But the lesions tend to be slightly similar, and they tend to appear in the same stage. In chickenpox, you find vesicles, papules, crust, or they're at the same stage. In monkeypox, they tend to be more or less at the same stage of a presentation.
Okay, super. Thank you. And how dangerous is monkeypox? Should we be worried?
Yeah, well, the majority of cases are mild. It seems the patients tend to get very low mood because they have to be isolated for days and days, and it's very difficult for people to be isolated with not seeing anyone. So the mood is a problem. When patients are immunosuppressed, they can get complications. The complications are secondary infection by bacteria. They can get up to sepsis. You can get lesions on the eyes, and that can cause inflammation and scarring on the eye. You can lose your sight if it's very severe. Very severe cases will give you encephalitis too. So it can cause death, but it's rare. And it will affect mostly immunosuppressed patients. And it seems in children can be more serious than in adults.
Okay, super. Thank you for sharing. And what is used to treat monkeypox?
Okay, so normally the treatment is symptomatic, painkillers, fluids, nutrition, but when the case is severe, they can have antivirals. There are a few antiviral medications that we use for smallpox, and they can be given to patients that are at risk. So there is treatment, but yeah, but not everyone gets treatment because the disease tends to be mild.
Okay, super. So only in very rare cases would you need.
Yes, in certain cases, or when the patients are at high risk, they may get antivirals.
Perfect. Super. Good to know. And how long does monkeypox last normally?
Yeah, normally it lasts a few weeks, like 2 to 3 weeks. The patients are that's why the isolation period is so long because the incubation can be 5 to 13 days, and then the disease can heal in a couple of weeks. The patients start to improve and to get clear of all the skin lesions.
Super. And we're on to our final question. How can monkeypox be prevented?
Well, with all the measurements we've learned from COVID, you need to try to keep your distance. If the place is very crowded, you have to use your mask to avoid the contagion. If you know there's someone with the monkeypox, and you're gonna visit them, you need to have all the protection equipment, the mask, the gloves, the special gowns. So you need to be very aware. The disinfection of your hands, use disinfectants on your hands, especially for virus, is also very important. And I think probably that's the way forward. The vaccine is very limited and is being given to patients that have to see to doctors or healthcare people that have to see these patients. They can get the vaccine. But the vaccine, there are very few vaccines around, and it's the same vaccine that was used for the smallpox.
Okay, perfect, perfect. So I suppose just one bonus question, if you will. Who's most at risk? Would it be people who are frequently in contact with other people?
Well, healthcare professionals are at risk, of course, because they see these cases. There have been many cases presenting on homosexual people. They present to the healthcare, the sexual health clinics in hospitals. It seems that there have been many cases reported on this group of men having sex with men, but anyone can get monkeypox.
Absolutely.
So you
Perfect.
have to be careful.
Of course, exactly. Of course. I think we've learned that from COVID as well. It's better to be
Yeah.
safe than to protect yourself. Of course, absolutely. Thank you, Dr. Emilia Duarte Williamson. We really appreciate you taking the time to speak to us today. Thank you so much.
Thank you, my pleasure.